Well, I've heard lots of people be asked that question. I was sitting on the other side as the new grad listening. What do I need to know? What's the one thing? And the one thing is have a mentor in nursing. Have somebody that you can look up to. Have somebody that you are not scared to ask questions to, and don't be scared to ask questions, because if you don't ask those questions, you don't know. Mm-hmm. And you need to know, and you need mentors.
Be patient. You're not going to learn it all in one day. Go easy on yourself. People tend to think that a nurse is a nurse is a nurse, and you can just pick somebody up from medical floor and put them on surgery floor and then switch them over to public health and you'll get along just fine because you're a nurse. But that's not the case. Every area is different, and my best piece of advice would be to be patient with yourself and take your time, ask lots of questions, realize that you're not going to learn everything in a day. You really need to have the courage to advocate for your patients and recognize that even though you are a new grad and maybe you don't have as much experience as your colleagues, you still have something to bring to the table.
My advice, I think it's very important for a new graduate to start at the bedside, to work for a couple of years. There's loads of different types of nursing you can do. But I think it's very important for a new grad to get their basics, get their organizational skills, get some little more workshop things under their belt, and just to be visible. Okay. And then go on and try the ICU, try Emerge, try obstetrics.
Oh, just go for it. Try anything you can. Try, and you've got a long time ahead of you. Start with one thing, change your job, and learn everything you possibly can, and just explore and have fun with it.
My advice to some girls or girls and guys graduating, I don't think you could ever go wrong with a good, sound experience in medicine or a med-surg area. Sometimes we have to go where the jobs are, and that's just the nature of the society that we live in. But there is always, nursing in my opinion is built upon experience, and there's never any one experience that will never come in handy to you down your road in your nursing career. I think don't settle. If there's something that you really want, seek it out. And start wherever you can get a chance. To be working is better than to not be, and we get our experiences from the smallest of places, and those are the things I think that kind of have a big impact in your nursing career. Working on a med-surg floor, on a med-surgical floor, just a medical floor, will give you a good background for whatever avenue of nursing you decide to go into. There's nothing wrong with learning the basics, and then once you have a good grasp on those, you can branch off anywhere. Nursing is going in a million different directions, and once you have a good appreciation for the core values that we all learn in nursing school, the sky's the limit.
Advice for new graduates, it would certainly be that they just get in there, learn as much as you can. You're new, you've got great ideas, share, and just just be a part of everything. Self-directed learning is so important in nursing, and I think right from the get-go you just need to learn as much as you can and just be part of all experiences possible, and it'll come, it'll come.
Advice to the new nurse is to be true to yourself, and you're there for a reason. You're a nurse for a reason, right? We have patients that we care for, that we provide care on a day-to-day basis, and that's probably, you can't lose focus on why we chose to be in the nursing profession. And always keep that front and center. That's the patient who's number one.
Keep updating your knowledge, like always go for more education, and don't be scared to ask questions, because I ask questions about everything and I still do, and just be confident, but don't be overconfident.
Okay.
Get your basics.
Yes.
There's all kinds of great specialties out there that we are loving to have new blood. Always be professional. Work well with your colleagues and learn from your colleagues. And the world is your oyster. There's all kinds of opportunities for nursing. And I fully believe in that. There's all kinds of opportunities in every area. So continue your education and look for new opportunities as they present.
Basically, get involved in everything you can get involved in. If there's a course here, is there a course there? Ask lots of questions with regards to, what can you get involved in? Even volunteer experience as a new grad. Just get involved in everything you can. Take as many courses as you can, and just dive right in there, because coming out as a new grad, you have all this fresh knowledge, and it's different than some of the nurses that are on the floor. So always communicating with them and asking them, which way do you do it? And then how you were taught, and then you can compare the different ways, and just it makes you a better nurse.
We have new grads working with us all the time, and we love them. New grads, they are the future of nursing, and they've got a thirst for knowledge. They're not afraid of hard work. They're not afraid of figuring stuff out or looking things up, or they aren't afraid of questioning. Well, why do you do that? And if we don't have a really good answer, then maybe we should look at, why do we do that? So what would I tell a new grad? I would tell them to don't lose that thirst for knowledge. Go to whatever workshops you can go to. Talk to your manager about what kinds of things would be a priority in their eyes, and that you could work with them to figure out what your learning plan would be, so that you can keep up with the most accurate knowledge, the best practice items, so that when you become a 5-year out grad like myself, you could be leading another group and be doing just fine with that.
I think the advice that I would suggest to them is go for the guts out. Believe in themselves. It's all about self-confidence and self-esteem, and knowing that they have the beginnings of their own toolkit, and open up that toolkit and share the toolkit with others, and learn to articulate and hear their voice. Hear their voice. Don't be hesitant to put that voice out there and to speak to others, and they'll grow confidence. They will build capacity within themselves, and they'll build capacity amongst their patients that they serve. And they'll do it in such a rich, natural flow that they won't have to hold back anymore. They'll realize where they're situated, and what they have to offer to others around them in making it better, the health system better for everyone. Because it's all about our healthcare system today, is everyone has a responsibility to it. So I think if they can really look at what they have to offer and to begin to really firm up those beliefs within themselves and share it with others, that's what I would say. Be creative and trust yourself. Trust yourself.
Good advice.
You listen with your ears, your heart, and your gut. Because I've learned many times over the years, if you have a gut feeling that something is going to go wrong, you're probably very right. So you follow that gut feeling and you do what you think you need to do. It may be something that won't always make you popular. I've been unpopular doing it over the years and probably stepped on someone's toes. But the patient always benefited in the end, and that's what matters. So that's one of the major things, is always listen. Never forget that you were once a young nurse. Make sure you take the time to mentor these young nurses and teach them along the way.
Learn from everybody. You will have co-workers, whether it be other registered nurses, nurse practitioners, physicians, LPNs, medical secretaries, the housekeeping staff. Learn from every single one of them. They all have something to offer. Even if it's someone that you don't have the best chemistry with, that perhaps that you don't get along with that person, there is something to learn from everybody. I have learned lots of things throughout my career from people I never thought I would learn things from, about something as easy as the housekeeping staff telling me, oh no, this is what we use to clean up vomit, you know, to physicians telling me, oh no, we always start with an ARB, like in this type of patient population, because they don't tolerate ACE inhibitors. So there's something to learn from every single person you encounter. So.
That they've worked really hard to what they've accomplished in life, and that they're going to continue to learn and work hard. But it's a privilege to be a nurse, to be a registered nurse, and to work with people from all spans of life. Like when you're a registered nurse, you have the privilege of working with people from their born until their last days. To always keep that in mind and to never lose that you know, it's a privilege, and that you have a knowledge and you have skills, and to always use those to do the best patient care that you can.
I love my job. That's all that I can really say. I love nursing, and I really do. I think the biggest thing for me is to try different areas, I think, and you'll find an area that you're most comfortable with. Whenever you graduate, obviously you get a placement first, usually in some sort of acute care setting. But for me, I love long-term care, and this has been the best choice that I've made, honestly. After the 3-4 years on surgery floor, I did love it there very much, and yes, you learn an awful lot, very much as far as the acute care setting and with the different illnesses and so on, and how to treat the patients with them. But I think really you have to find your niche and make sure that you're comfortable in it, and it's something that you can see yourself prolonging and going further with, and definitely long-term care has made that decision for me. So I think that's all I could really recommend, is try different areas, and don't just say, no, I'm not going to like that, I'm not doing it. Try it. Like I said, there's medical floors, things that you've got to do and you've got to learn. You've got to learn those things in those acute care settings, but definitely you have to try different areas and different populations. That's the big thing as well. But yeah, and don't give up. I'm like, there's still, like I said, lots of things you have to learn, and it's lifelong learning. Like you said, Audrey, you have to keep learning, and it's fun. Like I said, I love it. I really do love it. So.
Stay true to your education. Remember that you have the most current information and knowledge, and try and disseminate that to the other staff, because we kind of get into habits that are not necessarily the best habits, and they're in a great position to lead, and help educate staff.
Give yourself time. You're not going to know everything. Listen to those of us who have been around and share your knowledge too, because we can all learn from each other. But be patient.
Brand new coming out. Good for you. You've chosen a great career. Wonderful, wonderful opportunities out there. Come out, you've got to find a little niche that you like. Because we all come out and we try and get a work, we're trying to get work in a facility, whether it be long-term care, whether it be acute care in the community. You've got to find your little niche. What is it you like? Do you like maybe, are you suitable for the ED department? Are you suitable for perioperative practice? Are you suitable for long-term care? Long-term care is where the care is going now. I mean, that's where our population is heading. Just find your little niche and go with it. If you think further education will work, that you maybe want to go into more education role, maybe you want to head for the university, that's fine. Go and do your masters, do your PhDs. But frontline nurses coming out right now have wonderful opportunities. As I said, the preventative piece, there's so many opportunities coming up in the primary care sector, home care. It just doesn't have to be acute care anymore.
Well, I do have some answers, and I might come across as confident. I really don't know everything. The experience does play a large part in your knowledge and how you conduct your practice, right? So while I may have a good education coming out, I don't have that experience yet. I've worked on the floors before, and I've worked in different settings before, but I don't have that great experience that you may have already. So help me along, keep working with me, keep encouraging me. If you know something that I don't, share it with me. I'd love to know. And I'd love to know what works best for different people. Keep working alongside of me, and the big thing is being a good role model, like being that leader. That makes a huge difference, and communicating with me and respecting me, and I want to respect you back. And I'm really looking for somebody like that.
I think the best advice I could give would be to just really hold on to those standards of practice and just really hold on to why you became a nurse in the first place, because when you really think about what we are equipped with to deliver the best care we possibly can, I think all of those standards of practice and the quality of care and continuity of care and all those things that you learn in school that are really important, if you could hold on to those and really transfer them into practice and really care about where you're at and go for, pursue what you want out of your career. I knew I wanted to pursue critical care, and I just couldn't be happier with where I am right now. And it's really difficult when you come out and you're a new grad, but my goodness, you can learn so much from the staff and from your patients and from the physicians that are around, and I just am very grateful and thankful to be a part of this profession and also to be a part of the team that I'm in right now and to be a registered nurse.